Hello and welcome everyone in another episode of Researchers Celebrity. Today we have Dr. Achyut Saroj with us. A brief introduction of Dr. Achyut. He has done his bachelor's from University of Lucknow in Life Sciences, and then for masters he joined IIT Roorkee, which is one of the eminent place to perform any research or education in India in biotechnology subject. Then for PhD he joined SGPGI Lucknow and moved from India to United States for further research experience and joined National Institute of Health USA as a postdoc and worked in National Cancer Institute. Then he moved into different roles, worked in different places, and a brief overview of those will be he has worked as a scientific researcher in Henry Ford Hospital, Michigan, then joined Medical College of Georgia as an assistant professor, served as technical director and scientist at Emory University, Atlanta. Currently, also, he has multiple roles, and to start with, he is uh, working with Emory Healthcare as a spiritual care provider and also working with Tatva Health as a consultant. And the journey goes beyond this. He is an entrepreneur and also founder of AwareOnc also. With this brief introduction, I would say thank you so much, Dr. Achyut, for taking time for this conversation.
Thank you for inviting me. Happy to be here. Yeah.
We always start these conversations that how and when you decided that you want to become a researcher.
Yeah, that's a great question. I think if I look back my previous life, I think the time when I was in IIT Roorkee doing my biotechnology, I was taking a genetic engineering course, and I learned a lot about the Human Genome Project and how it can help in several diseases, especially diagnosis and treatment. And that's where I actually started learning more about the cancer, and I got fascinated by it. And that was the time when I think I should go deeper, and that gave me a motivation for my PhD also. Yeah.
So that's where in the masters the quest for research started,
Yes.
almost more than a decade. So let's start with the decision when you said that okay, now I want to do PhD, because you said that after masters that was the time when you were like okay, now I want to do a PhD. So the key factors which drove you to make this decision that you want to pursue PhD, and then we'll take from there.
Sure. Yeah. I mean, as we all have, like in master degree, we have some projects at the end. Like last semester, we have to work on some project. Um, I did some project, and the overall the research strategy, the experiment design, and then routine meeting with the supervisor. So all that process I went through, it gave me a kind of brief idea about how research works, and excited me. I can do more research, and that was the time when I decided, okay, what topic, something I can choose. The cancer was something that was, I got motivated with, because I see in our community a lot of patients, relatives or friends, side, I see death. So that gave me a kind of motivation. What is cancer? How it develops? What are the treatments around? And how I can help as a researcher. So that time, the treatment was there, but if I compare now after 20-25 year, the treatment strategy has changed. There's a more research. So that was the time I think I started the cancer journey over there as a researcher. And now I'm doing cancer, just touching the patients, helping, supporting them. So I see the huge, spectrum of cancer research, and the supporting the patient at right time. I think it went really well. Overall journey, I really appreciate. I work with different mentors and work at different institutions, but I see a huge need that time, and even right now I see a huge need of people can go through their training and help support the cancer patients. Yeah.
So, joining PhD at SGPGI Lucknow, which is already known for research they do and the patient care they provide, how was that different for like doing it in an academic institution or in a research hospital?
That's a great question. I think what I see is, since it's a tertiary care hospital, every day there are patients, not only cancer patient, but different, depends what disease it is. It could be infection, it could be stroke, it could be any neurological or any immunological disease. So that gave me a kind of a context, and again, keeping me, center to the patient care. And when you see patient, when you see during our discussion we are talking about patient, and seeing patient going through, the process of hospitalization, or it could be outpatient, not inpatient. So those processes put you always, in a thinking mode why patient care is important. Compared to academic, that's also important, but having, doing the PhD, in the healthcare setting, is always, morning to evening, you are always centered around the patient. So that gives you extra layer of motivation for sure. Yeah.
Absolutely. So, what were the challenges which you will say and share with the audience that if you are doing PhD in academic institutions, okay, like you did your master's in IIT Roorkee, known for research but still seen largely as an academic, whereas when it comes to SGPGI, it is largely about working with patients directly and serving them like immediate responses. So the research is somewhere in the background. So what are these pros and cons you can suggest the people who are thinking or still in dilemma that where they should join the PhD?
I think for PhD, number one thing is your supervisor, the support of the supervisor, and the collaborative environment. That is the first thing. Doesn't matter it's academic or it's a clinical setting. Even, I can just start with the hospital setting and SGPGI, for example. Ultimately, if you're working on a disease, you need some patient information, patient specimen, for example. That's, I think, easy to get when you are in healthcare setting compared to academic. So that is one, I would say, one easy way to, move towards your PhD, because every time you need some samples, right? Like blood sample, tissue sample, or even, your collaboration with the other clinical supervisor. Like sometime you have a co-mentors, so it's easy to get there. In academic setting also, I see a lot of collaboration of those academic institution with the healthcare setting. So maybe mentor or supervisor is in academic center, and then co-mentor is in healthcare setting. So that kind of collaboration is there. So both are good. I think so far I have seen like many friends, they are in academic, but they do have a good collaboration. That collaboration could be like a supervisor to the co-mentor, or it could be academic institution is overall collaborating with the hospitals, for example, right? So it could be at different level, but there are pros and cons. But I will say the one of the main important thing is how is your understanding with your supervisor, and finding the correct co-mentor. And there's a research committee like who works with you all the time during your PhD work. So all those layers are there. But I can talk about healthcare setting is like, I think it's super easy. That was super easy for me, because most of the time researchers are trying to find sample like specimen. So it was easy for me that time. And even we had students coming out from different academic institution, they were collaborating with the PGI. So I can relate that there are some challenges for the academic institution. But again, if there's a proper collaboration, and your co-mentor and you are on right page, and routinely meeting and looking at what is the requirement, maybe in 3 months, 6 months, or maybe for a year. So plan accordingly, collaborate accordingly. I think that helps.
Absolutely. And I think the point which is wonderfully mentioned here is like based on your research question, like you, if your research is more clinical based, where you have to have patient samples and all that, then it is better to join somewhere like hospitals, as you said, the clinical settings. Whereas if it is like more fundamental, but every now and then you need patient samples, then you can join the hardcore academic research facilities. Sure. This brings us to our next question, that once you were done with your PhD, what were the thoughts which were going on in your head as a newly received doctorate?
Yeah, I think this question kind of reminds me, take me back in my past. So I can definitely talk about it. So the question that I believe I was thinking that time, what else I can do, what are the other resources I can use, maybe within India, maybe outside of India. So the question I was working in my PhD was about like a gastritis and gastric cancer. So my goal was just to go more deeper into that research, and I was looking for different institutions. And one of the major institution in, I would say, the whole world is the National Cancer Institute, which is one of the institute within the National Institutes of Health at Maryland in USA. So I thought that's one of the top most institute in the whole world. I should try there. And luckily, I found one of the lab called Laboratory of Cancer Biology and Genetics, and they had this gastric cancer project. And I was able to get there. I applied, and I got interested in that particular project, and reached out to the investigator who was handling that project. So overall, I think my PhD experience was kind of matching with my future goals in cancer research, specifically like gastric cancer. So I was the perfect fit in that lab. And this is how it started. During the PhD you think something, but you realize maybe you want to change the route, or maybe you want to go deeper into that particular project. So depends upon at who is actually doing the research and what's their. Sometimes people want to stay in like India, and they want to explore around again, depending upon the family situation and all. But for me it was the case, like I wanted to go more deeper into the gastric cancer, and I found the lab, and I was really happy to get there. Yeah.
Okay, so what were the first challenges which you faced when you moved out of India to United States?
I think I would not say challenge, but I would say excitement. I was overall excited that first of all, it is excitement, and sometime also, okay, what will happen, how people will like me, or I will like the place. So that kind of uncertainty is always there with everybody. But that was more about excitement, that I'm getting into a prestigious lab, and I'm going to work on a cancer, and that is something I like to explore. But challenges side, the everybody gets the initial challenges, maybe little bit of fear, maybe little bit of uncertainty, but it's difficult to actually explain that. But once you get here, in few months, maybe a year, you get acclimatized, or you get, when once you start getting all the support around you, could be your lab member, your supervisor, your family and all that, and you develop a friendship circle around you, then you feel comfortable. But for everybody who comes at here at first time, and they have to go through all those processes for sure. Yeah.
So this is also one of the thing which we talk in these conversations, that when a fresh, passed out PhD scholar thinking of moving out of India, and then they are fascinated by the countries, their cultures, like what they do not know firsthand.
Yeah.
So everything sounds very fantastic, or watching in movies or whatnot. But when you land there, What you 100% know is the science you do, because that is, as you mentioned, that you are a perfect fit. The supervisor knows that you are going to do a great job in the project, that's why you are there. But when you are there, the real some of those, and that's why we say challenges, because in India not most of the boys cook. Okay, that is one of the challenge, that when they are here, now it starts like, you have to cook your own thing, you have to plan, you have to do all the household chores on top of your research. Whereas in India, it is the science which you do, like 98%. Rest, especially as a PhD scholar, when you do not have that work life balance thing. And then now we will talk about how did that turn out for your initial postdoc days and till now, then we'll go ahead.
Yeah, I think you're asking about the support system and initial challenges. So again, you know, depends upon person to person how they take it. They take it as a challenge, or they take it as a, opportunity to grow overall, right? Because of course you are here by yourself, or maybe you are with your family, and every day there is something you need to take care of, the household thing, and lab project, and sometimes you bring some those kind of challenges to your house when you are, you have questions, something didn't work in your lab, then you have to, kind of maybe write some proposal, write your manuscript or article at home. So those overlaps are there initially, and it's hard to maintain the boundaries initially, because and that time you haven't learned that, I believe, and once the time moves around and you learn how to do that efficiently. But initially you are more into the research, and maybe you're working late at the lab and you're coming late. If you're alone you can manage easily, but if you're with the family, there's a family expectation, and sometimes people have like kids at that time, in that postdoc time, then you need to manage all that. And I came with my wife, so there was a support there, and we always talk about it. And I think it was the process, we grew out of those challenging times. Then we have kids and you have to manage again. It's a part of growth, how you take your life, and at the same time you're growing in your career. So it's a process, but everybody has to go through it. And that's where you establish your support system around you, maybe
Mhm,
friends, maybe your supervisor, maybe somebody in your lab, maybe somebody where you live, your neighbors,
mhm.
and maybe your friends. Maybe you have friends in the same city who also came for the postdoc. So it's a mixed situation, and it's a complicated, but once you are determined, you know to progress and learn, I think you figure it out how it works for sure. Yeah.
So this brings us to a very important part, and now this topic is being discussed in all the forums whenever the researchers meet, that the work-life balance in states is different from rest of the world. You
Yeah.
have worked in India and then moved to United States. What you can share based on your experience to the people who are considering to move to United States?
Yeah, I think that's a fantastic question for the work-life balance. I think it starts from you. How you take the thing, you take it as a challenge, you take it as, I think I mentioned that before, you take this opportunity, just to grow. One thing I can say, I think self-care is important. Connecting with your own community is important. That's where, we have a temples, and any social place, any social gathering. So overall, as a human being, or any anybody in animal kingdom, we see we need a support system for survival, and we do have that kind of instinct, right? So I would definitely suggest, and that also helped for me, like going to temples, right? And finding people there, maybe you can meet, and you'll see there some people you are easily mixed with, right? Maybe you have kids and you like to make more friends for your kids. So there are different opportunities. I think everything is started for me from the temple. I stayed at different places, and everywhere I think if you want to meet people, going temple is really important, for your own spirituality and for your social circle. And we have all those places, if you are, at, metro cities like Atlanta, for example, we have so many temples. We have Chinmaya Mission, like I'm associated with Chinmaya Mission for the last 7 8 years now. So, and we go every Sunday there. Maybe we provide support as a volunteer, right? Or sometime I need support. There are spiritual studies. So I think if you are here, for example, if you follow Hinduism, then those are the places. But if you follow different religion, you will find some other spot for sure. So everybody will get something out of it if they actively search for it. Self care is important. Boundaries are important, and at the same time, enjoy your life. There's so many things to do here other than the lab work and the family. You can go out, even park, even different places. Just uh, get some fresh air outside time to time. That's so important. Yeah.
Absolutely. And this is something which we always talk about, that do whatever makes you happy, because as you rightly mentioned, that all humans are animals at in indeed, and
Yeah.
we have to have a social circle,
Yeah.
and that is what gives us the support system. You mentioned that for researchers, like, support system is crucial for any human being.
Yes.
It becomes even more crucial when you happen to be a researcher who experienced a lot of, you know failed experiments, missed deadlines, which brings all this, I'll say that, pressure, frustration, and whatnot all. So based on your experience, you can guide our audience that how they can utilize their, either it is the support system, or as you mentioned, or also we should take this opportunity to talk about the spiritual care which you provide to them, like how whosoever, because everyone is different
Yeah.
and they might have their different rejuvenation points.
Yeah. For me, the spirituality, I think that is so important because that gives you balance. Maybe it's a failed experiment or maybe anything in your life. So that's why I mostly, preach, self-care is so important, because once you handle yourself, you can handle everything around you. And time to time going inward is so important. Right now, I just wrote a blog about the fall season. I see the leaves are actually turning orange and red and falling from the tree, right? So sometime you have to let it go. If something is not working, let it go, just like trees letting go the leaves because it's a fall season. It could be because of energy conservation for the tree, because it cannot hold the leaf. And those leaves will come back in spring. So just think about it. Just giving an example of a tree and fall season, you have to go through these kind of challenges, the fall, when you have to let it go. Maybe some project is not working, you must have the alternative experiment, alternate project, maybe that works, right? If you don't think your supervisor is like a that collaborative or supportive, then you have other options. You can let it go, find some other places to work, for example, right? So there are many things, but you need to be like, find out yourself where you get those support within you. And for me it was like always, going into detail of Bhagavad Gita, because I'm so, um, kind of always inclined towards it. I even wrote a book about Bhagavad Gita and how we can use Bhagavad Gita for the cancer spiritual care. And I'm all author now, it's on Amazon. So yeah, I mean, I was always fascinated about the self-care support system and giving a support system to the cancer patient, because my life started from cancer research, I'm more into, going into more, handling the different kind of stakeholders in the cancer setting, and now supporting the patient, just direct interaction with the patient. So again, spirituality helped me before when I landed here. Spirituality is helping me now, and I'm trying to support the patient at the same time with my experience, that I'm going through different trainings right now, like Hindu spiritual care through Chinmaya mission, and also doing some spiritual care support, giving those support to the cancer patient at Emory Healthcare, as you mentioned before. And plus, I have my own, company now. It's called AwareOnc. It's awareness about cancer, mostly touching the spiritual dimension of the cancer patients and emotional support that they need, other than the treatment, which is always dealing the physical aspect of the disease, but they do need the spiritual support and emotional support. So overall, when I see my journey and my future goals, they are always, around support system, learning about the cancer. Even cancer, I don't see only physical disease, it is emotional and spiritual disease. So overall, I think what I can help is spirituality had, helped me in the past, and it's helping me. I think that would be the basic, need for everybody, and I'm happy to talk more about it. But yeah, just that was the kind of extended answer. Yeah.
So now, as a researcher, people are, either it is Ayurveda or you mentioned Bhagavad Gita. Now there are different research groups which are trying to understand, the underlying science behind what has been said or has been written. So if we can ask you this based on your experience, and now you're already, healing people using your understanding of cancer as well as the spirituality version part of that, what you can suggest or you know guide some of our audience who are considering to be more inclined towards spirituality, but
Right.
they are like limited by the acceptance of current researcher world.
No, I think that's a valid point. I think it's, for me, it was my own journey, because I see a need of physical health. We can treat the cancer with the drug, because it's a DNA, it's a tumor microenvironment, because they are cells we have to target. But I think that part is taking that, the thing that, we have to fight against cancer, that kind of you know um, the way we think about the cancer, like fighting, like, yeah, there is a cancer, there's an entity, we have to fight with it, we have to target it. But it took me some time to evolve from that kind of mindset, because I feel like cancer is, it is starting from your own body, how you can fight the cancer, right? So that means you can heal it. Of course, medical care is so important, but at the same time, somebody who's going through the cancer journey, they can utilize some healing mechanism, like, support system, emotional health. And that's where, the research says, when you have those kind of support system, patient who are undergoing the journey, they have a better treatment response, they heal better. So all those things are super easy, because patient is not only the physical disease, right? It has to go through the emotional challenges also, right? And practical challenges, maybe financial distress, maybe the person is like alone, no, don't have that many support around, like family support. So that time, I think, we need those kind of supportive care, like emotional support, spiritual support. That's so important. I'm so sorry, there's a, the background noise. I think somebody's cutting the grass.
It's okay. So if you can tell us something more about how AwareOnc works and your training as a researcher, like through your all research training, starting from PhD to postdoc, and then the rest. that path you took, how that has trained you to become an entrepreneur, have your own AwareOnc, and still working as a consultant with Tatva and Emory also.
Yeah, I think that's a great question again. I mean, for me, it was a journey because I started seeing cancer, doing research on cancer. Um, Sometime, the treatment I'm using in the lab setting, it works. Sometime it doesn't work. Even I use the animal models to treat cancer, and sometime I see it respond, sometime it doesn't respond. Depends how what question we are trying to answer in that model system. But you know when you are growing spiritually, you have a family, and over the time you start thinking, why something is not working. You try to ask question, you do the self inquiry part. And that happened with me, because it's still cancer patients, they are dying because there's no good treatment. It's still, if you compare 5 10 years back, we do have a better treatment. But just treating patient, I think that is not enough. And I learned that through my experiment, through my kind of experience throughout my journey as a researcher, as a scientist, right? So I started thinking, what are the other ways I can support patients? Just not by working as a researcher and finding that cure for it, finding the best treatment, but what is something that everybody is missing, right? Then I started thinking, connecting dots with the Bhagavad Gita and a lot of other Upanishads we have, how Hinduism sees, human being, why human beings suffer, right? Because we associate ourselves as a body. So I started thinking more about going into Upanishads and Bhagavad Gita, that we are not the body, we are the spiritual being, we are the emotional being, and we have this bodily experience and physical experience. Because Hinduism do support, reincarnation and rebirth. So if we take that as a, big picture, this birth is just a piece of a puzzle. And if we try to associate ourselves as a body, our like dislike, our attachments, right, our desire, then we suffer. But if we take this as an opportunity to grow and experience our real nature, which is, in Hinduism we call it Satchit Anand, right? Satchit Anand, right? So we are always happy, but we think that we are not because of life's ups and downs. And same thing happened with the cancer patients. So so for me, I'm not trying to teach spirituality to patient, but right now I'm taking course, or I'm supporting patient as a part of clinical pastoral education in Emory Healthcare, where I see a lot of patients, not only the Hindu patient but other faiths also. And our goal is to listen to them, what is going on in your cancer journey, and support them emotionally. Just listen to them, not teach them anything like what scripture says, but we go there as a resource to listen them and talk to them non-judgmentally, provide those compassionate presence, listen to them, and guide them that you know things are things will be fine, and finding out what support system they might be looking, or maybe resources, and connect them with those resources. And sometimes we also talk to their caregivers, like maybe family members, because when somebody is going through the cancer journey, not only the patient but the whole family is disturbed. So what is the spiritual support that patient need, and other family member need? So we try to talk to them and support them emotionally and spiritually, and sometimes connect with the resources, right? So that is the goal of a spiritual care provider. So that I'm doing with the Emory Healthcare as a part of clinical pastoral education. But through AwareOnc, which is my company, we call it AwareOnc LLC, I'm actually developing all the resources for the Hindu patients, and sometime it is for interfaith patient, where the cancer patient can go and find those resources, or they can connect with me also directly. So it could be, what are the mantras that are like healing for the cancer patient, what are the specific verses or mantras from the Bhagavad Gita that can support them, right? For example, we should not get attached to the fruit of action. We should be, and we should take our life as a karma yoga, not just doing the action. We should get rid of ego, for example. So how that thing supports cancer patient or maybe family members? Just changing the attitude, and that can be done just by talking to the patient and asking what is the thing that patient is going through emotionally and spiritually. So that is part of my company and my journey as a spiritual care provider for the cancer patients. But as you said, I'm also consultant in Tatva Health, which is a AI based company. And since I have a huge uh, oncology experience in like 2 decades, I'm acting as a consultant just to support them build a knowledge base which is more AI based precision oncology product. And how we can support the oncologist, the treating physician and pathologist who's diagnosing, helping in diagnosing the those cancer patients. So since the precision oncology cancer field is so much growing these days, there's a new treatment, new diagnostic tests are coming up. So my role as a subject matter expert and consultant to help build those products, AI based products, and support and answer some queries coming out from the oncology side. So that is so exciting. I see that AI is also trying to help the cancer patient in that way, and the hospital system. At the same time, I'm using my own spiritual awareness and those training to support the cancer patient. So I would say physical aspect and spiritual aspects both are actually combinedly I'm trying to help. Yeah.
Absolutely. And I think this is wonderful bringing these two different dimensions. Not many of the researchers, as the current world goes, don't see it the way you bring this amalgamation, which is perfect, I will say. So, the last question which I'll ask for this, that starting as a young budding researcher who just making up the mind that, okay, I want to do a PhD, and now being mentor for many and having your own company, one thing which you love about your research and one thing which you think could have been better.
I think for anybody it's a process, like, because you have to go through different life, I would say challenges, learning phases and all that. And by the time you're also learning and pivoting so many things, right? So if I see myself as a researcher like 25 years ago starting my project after the PhD versus now, things changes because your thinking process changes, your family, your career, everything changes because you grow out. I think that which is a good thing for everybody. You're not stuck to one thing because life doesn't work like that. It's, you have to be more flexible, you have to be more open, always try to learn from your mentors or by your experience also, and take positive feedbacks, and always open to learn, be flexible. Those are the things I think that helped me. And if you're really passionate about your project or something, always try to find collaborate with the people, so that you can actually grow mentally, right? Because the whole goal is how we can grow and how we can find some solution. But sometime there's no solution, and you need to accept that and you need to pivot little bit. And then for me it was how I can support the cancer patient at the very first point. I told you very beginning that a human genome project that fascinated me, and how I can go into depth of the cancer. And now I'm seeing going into depth, it's not only the DNA, it's not only the physical aspect of the cancer, but it's also the whole patient care. Like, patient is like a holistic support that patient need. They need emotional support, they need spiritual support, they need physical support, right? And they do have a practical needs, how they will go for the doctor appointment, right? So those support system is needed, and we should look our life also as a researcher in a holistic way, and always open to learn and grow. That should be the whole thing. And the one message for anybody who's going through the PhD work, or anybody wants to land into the PhD work in future, maybe is thing like always be open, be flexible, be open minded. That is the only one thing you can do. Yeah.
Absolutely. And I think that's how good researchers are made, anyways. Like with this flexibility, open minded learning, and then taking the feedback as positive, being passionate, and collaboration again is the key. With this, we'll say thank you so much, Dr. Achyut, for sharing this journey and enlightening some more researchers for their future goals. To all the audience, we'll say stay tuned for another episode of Researchers Celebrity. And if you want to connect with Dr. Achyut, you can find him anywhere on the web. If you want Empowering Sense Foundation to help you connect with our researcher celebrities, we are there to help you. The only one thing which we want from you all, that do whatever makes you happy, and if research happens to be that, we are here to support you in all the capacity which we have. Thank you so much, Dr. Achyut.
Thank you. It was pleasure talking to you. Yeah.